Is it just indigestion or a heart attack? Knowing the difference could save a life. That burning feeling in the chest after a meal may be harmless heartburn, or it could be the first warning sign of a heart attack. How can you tell the difference?
A heartburn is usually digestive origin and is usually a burning sensation in the chest that may happen after eating, when lying down, or after spicy or fatty foods. It often improves with antacids, often less urgent. Burning sensation behind the breastbone often starts after eating, may improve with antacids. Usually does not spread to the arm, jaw, or back.
In first aid differences for a heartburn. Monitor if it seems like heartburn first. Stop eating. Sit upright and take antacid if appropriate. Watch for worsening symptoms.
And first aid differences for a heart attack is, even when in doubt, treat it as a possible heart attack and seek emergency medical help immediately. The person has risk factors such as high blood pressure, diabetes, smoking, high cholesterol, or a previous heart problem. If it may be a heart attack, act now. Call emergency services immediately. Help the person sit comfortably. Loosen tight clothing. If advised locally and not allergic, chew an aspirin. Be ready to start CPR if they collapse and stop breathing normally.
When to treat it as a heart attack. If the person is over 40, has diabetes, high blood pressure, high cholesterol, or a history of heart disease, and develops new chest discomfort, shortness of breath, or sweating, treat it as a possible heart attack until proven otherwise. The safest rule is simple. Heartburn can wait, but a heart attack cannot. When chest symptoms are unusual, severe, or accompanied by sweating, breathlessness, or pain spreading to the arm or jaw, seek emergency help immediately. Quick action saves heart muscle and can save a life.